welcome to Alacrity Explains Anatomy. Today we are going to be looking at the anatomy of the cubital fossa. So by the end of this video, you should be able to define the cubital fossa and state its anatomical location. Define and state its anatomical location. You should be able to describe the boundaries of the cubital fossa. You should be able to list the contents of the cubital fossa from medial to lateral, same thing as from lateral to medial. You should also be able to explain the anatomical basis for venipuncture in the cubital fossa and discuss clinical significance of the cubital fossa in brachial artery pulse palpation, blood pressure measurement, and median nerve injury. So let's get to the details. What is a cubital fossa? The cubital fossa is a triangular fat-filled depression. Triangular fat-filled depression located in the anterior aspect of the elbow joint. Why is it important? It is a clinically important passageway for major nerves and vessels between the arm and the forearm. It's a clinically important passageway between vessels and structures between the arm and the forearm. It's a preferred site for venipuncture, which is a procedure for drawing blood, for blood pressure measurement, as well as palpating the brachial pulse. So this is the cubital fossa. As you can see here, these are cubital fossa. So we have structures passing through this space from the arm into the forearm. So what are the boundaries of the cubital fossa? Take this to be your lateral side and take this to be your medial side. So like we said, it's a triangle. It has a base, which is this part here. It has an apex, which is this. So what's the base? The base is a line drawn through the two epicondyles of the humerus. You know, if you have not watched our video on the osteology of the humerus, go and watch the video on the osteology of the humerus. You know, the lateral and medial epicondyles. So the base of the cubital fossa is a line drawn through, is an imaginary line though, not a physical line, but an imaginary line drawn between the two epicondyles of the humerus. The lateral border is formed by the brachioradialis muscle. The medial border is formed by the pronototeres. This is brachioradialis muscle. This is pronototeres muscle. The roof is formed by the skin, superficial fascia, and deep fascia, as well as the bicipital aponeurosis. See this fascia you see here, the bicipital aponeurosis forms part of the roof. Then we have the floor, which is formed by the brachialis muscle and the supinator. The brachialis muscle forms the floor medially, while the supinator forms the floor laterally. What are the contents of the cubital fossa? This is very, very important. The content of the cubital fossa, like we said, from medial to lateral, is a standard order for memorization. Standard order for memorization. Now you have the mnemonic MBBR to help you remember this. Now from medial to lateral, we have the medial nerve, which is the most medial structure. We have the brachial artery that divides into a radial and an ulnar artery at the level of the radial neck. We have the biceps brachii tendon. We have the radial nerve, which is the most lateral structure, but lies what? Deep to brachialis and brachioradialis muscle, often outside the true fossa, sometimes outside the true fossa. So some textbooks don't include the radial nerve depending on their understanding of the cubital fossa. So what is the mnemonic for content of the cubital fossa? We have MBBR instead of MBBS. We have MBBR from medial to lateral. M, the first M stands for medial nerve, the next B stands for brachial artery, the next B stands for biceps tendon, the R stands for radial nerve. Now if you look at these structures, this is our lateral side and this is our medial side. So if you are looking at the content from medial to lateral, we have the medial nerve first, which is what you have here. Then the next one is your B, which is what? The brachial artery. We have the brachial artery here. Then your next structure is what? The biceps tendon. Then the last one is the radial nerve. You see how the radial nerve is slightly going outside the true fossa. It is the superficial radial nerve that is deeply into the fossa. So some sources will tell you the superficial branch of radial nerve, some will just say the radial nerve. So this content of the cubital fossa, let's comment on the content of the cubital fossa. We have the medial nerve, which we said it lies medial to the what? The brachial artery. It leaves the fossa by passing between the two heads of pronator teres muscle. The medial nerve leaves the cubital fossa by passing between the two heads of pronator teres. Now, because it's passing in between the two heads of pronator teres muscle, it can be compressed. And if it's compressed here, what do we have? Pronator teres syndrome. Pronator teres syndrome. We have the brachial artery, which is palpable for pulse, shock assessment, as well as BP, that is blood pressure measurement. Now, in the cubital fossa, there's a bifurcation point at the level of the radial neck, the neck of the radius, the deep to the bicipital aponeurosis. The brachial artery divides into an ulnar, the medial, and a radial, the lateral artery. The brachial artery divides into a radial artery and an ulnar artery in the cubital fossa. Now, the biceps tendon, it is palpable in the fossa and it inserts into the radial tuberosity. Function, it supinates the forearm and flexes the elbow. Supinate forearm, flexes the elbow. Supinate forearm, flexes the elbow. Functions of biceps muscle. Biceps brachii muscle. Supinate forearm, flexes the elbow. Don't forget that, please. Then you have the radial nerve, which actually lies in the lateral gutter of the fossa, like we said. It is between the brachialis and brachioradialis muscle. It divides into superficial and a deep branch. Look at this. You have a superficial branch of radial nerve and you have a deep radial nerve. It divides into a superficial and deep branch, which the deep branch is what we refer to as the posterior interosseous nerve. So this is an image of blood pressure measurement where they are measuring one's blood pressure. So you see that the cubital fossa is important in blood pressure measurement. Now, what are the superficial structures in the roof? You have veins. These veins form the roof. You know, when we're talking about structures in the cubital fossa, we said that in the roof we have superficial and deep fascia. We have the skin. So the veins in the cubital fossa, there are veins in the cubital fossa, not inside the cubital fossa, but in the roof of the cubital fossa, that are important. Here we have the median cubital vein, which is the major one. The veins are cephalic vein and the basilic vein. Now, the cephalic vein and the basilic vein runs laterally near the brachioradialis, while the basilic vein runs medially near the pronator teres. So the median cubital vein, it connects the cephalic vein and the basilic vein. The median cubital vein connects the cephalic vein and the basilic vein. These are median cubital vein. These are cephalic vein. This is the basilic vein. The basilic vein and the cephalic vein are connected by the what? Median cubital vein. These are superficial veins of the cubital fossa. Now, why is the median cubital vein a preferred site of venipuncture? Any of these veins can be used for venipuncture, but the median cubital vein is a preferred site for venipuncture. This is because the bicipital aponeurosis, which is a tough fibrous sheet, lies deep to the median cubital vein, therefore protecting the brachial artery and the median nerve from accidental puncture. You know, if you look at the structures from outside to inside, you have the skin, you have the superficial fascia, you have the median cubital vein, then you have the bicipital aponeurosis, then you have the brachial artery and the median nerve. So during venipuncture, the bicipital aponeurosis is protecting the brachial artery and the median nerve from injury during venipuncture using the median cubital vein. So in summary, the cubital fossa is a triangular depression on the anterior aspect of the elbow. It has a base that lies between the medial and lateral epicondyles of the humerus. It has a medial border that is formed by the pronototeres muscle, has a lateral border formed by the brachioradialis muscle, has a floor that is formed by brachialis and supinator, has a roof formed by the bicipital aponeurosis, which is deep, and the median cubital vein, which is superficial. And the contents from lateral to medial, we say using the mnemonic MBBR. We have the median nerve, the brachial artery, the biceps tendon, and what? The radial nerve. Thank you for watching. Don't forget to like this video, share, and subscribe, and drop a comment if you have any question. Thank you for watching.